ABC of Gonioscopy, Professor Rekha Khandelwal, NKP Salve Institute of Medical Sciences, Nagpur. Gonioscopy is a bimicroscopic examination of the angle. Greek scientist Alexiotratas in 1899 invented gonioscopy. Omission of gonioscopy is a common cause of misdiagnosis worldwide. Light coming from the angle undergoes total internal reflection at the cornea-ear interface. Gonioscope negates this effect and allows angle viewing. There are two types of gonioscopy, direct and indirect. Direct gonioscopy gives a direct view of the angle. It is suitable for congenital glaucoma and angle surgery. Frequently used lenses are Coppes, Barkans, and Swan-Jacob. Indirect gonioscopy is done by two types of lenses: Goldman style, which requires a coupling fluid, and the Zeiss style, which is smaller in diameter and suitable for indentation gonioscopy. Patient is seated comfortably and the doctor's hand is well supported. Gonioscopy is performed under topical anesthesia in a dark room using a short beam of light to minimize pupil constriction. Always start with a low magnification. For a two-mirror gonioscopy, a coupling fluid is required. In indirect gonioscopy, inverted image of opposite angle is seen, but the right-left orientation remains unchanged. In a gonioscopic view, the structures from anterior to posterior are Schwalbe's line, non-pigmented trabecular meshwork, pigmented trabecular meshwork, scleral spur, and ciliary body band. Schwalbe's line is the peripheral termination of Descemet's membrane and is seen as a thin, pale, linear ridge. If there is doubt, use corneal light wedge technique to locate the position of Schwalbe's line. Trabecular meshwork has anterior non-filtering portion and posterior filtering portion which is pigmented. Pigmentation can be segmental and is more in the inferior angle due to gravity. Hyperpigmentation is found in aging, pigment dispersion syndrome, pseudoexfoliation syndrome, uveitis, and trauma. In pigment dispersion syndrome, trabecular pigmentation is heavy, homogeneous, and uniform. Pigmented Schwalbe's line or Sampolisi line may be present in pigment dispersion syndrome. In pseudoexfoliation syndrome, scallop pigmented Schwalbe's line is seen, called as Sampolisi line. It is also associated with dandruff-like deposits in the angle and patchy pigmentation of trabecular meshwork. Scleral spur is an important landmark in gonioscopy. It is seen as a white glistening line above peripheral iris. Identifying this structure helps to differentiate open angles from closed angles. Anterior ciliary body band is seen in eyes with deeper angles. It is grey-white to brown in color. Irregularities in width is seen in angle recession and cyclodialysis. Widened ciliary body band is seen in angle recession due to tear in longitudinal and circular fibers of ciliary muscle. It is an important cause of secondary glaucoma in young adults. The insertion of iris and peripheral iris configuration is important to note. In uveitis, peripheral antiacynici are found, which are solid, sheet-like, and composed of iris stroma. They obliterate the angle recess, whereas iris processes are fine, lacy, and do not obstruct the flow. Before starting gonioscopy, perform von Herrick technique using a light beam kept at 60 degrees to grade anterior chamber depth. When peripheral anterior chamber depth is less than 1/4 corneal thickness, the angle may be narrow. The most commonly used grading systems are the Schaefer and the Spathe systems. Schaefer is based on angular width, whereas Spathe takes into account iris insertion, angular width, peripheral iris configuration, and trabecular meshwork pigment. Modified Schaefer's is widely used grading system. The angle is grade 4 open if ciliary body band is visible, and grade 0 if shawl base line is not seen. Indentation gonioscopy is performed using Zeiss 4-mirror lens. Aqueous is pushed in periphery. If there is appositional closure, the angle will open with indentation. Hence, it differentiates appositional from synechial angle closure. Idoconial endothelial syndrome is characterized by peripheral antiasynechy extending to or beyond shawl base line. Mesodermal dysgenesis is characterized by posterior embryotoxon and multiple iris processes adherent to anteriorly displaced shawl base line. The status of trabeculectomy stoma can be visualized by gonioscopy. Gonioscopy is valuable to examine tube position in glaucoma drainage implants. Iris and angle neovascularization is commonly found in proliferative diabetic retinopathy and central retinal vein occlusion. Normal vessels are non-branching, radial, and do not cross scleral spur. The new vessels in angle are fine, arborizing, and cross scleral spur. In advanced stages, it leads to peripheral anterior synechy formation and angle closure. Gonioscopy is an essential diagnostic tool for a complete eye examination. Mastering the various techniques of gonioscopy is crucial in the evaluation of glaucoma patients.